Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been experiencing some troubling symptoms lately.
I'm sorry to hear that. What symptoms have you been having?
Well, it started with some discomfort in my upper abdomen. I thought it might be indigestion, but the pain has gotten worse and I've been feeling nauseous, especially after meals. I've also noticed my stools look pale.
I see. Do you also have any jaundice or yellowing of the skin or eyes?
Yes, I notice my eyes look yellow, and my skin tone seems to have a yellowish tint too.
That can be a sign of liver or biliary system problems. Have you experienced any weight loss, fatigue, or itching?
Yes, I have lost a few pounds without trying, and I've been feeling tired all the time. The itching is something new, and it's been pretty intense.
Those symptoms are concerning. Have you had any changes in appetite or any other gastrointestinal symptoms?
I haven't had much of an appetite lately, and I felt bloated after eating just a little bit. No other symptoms, though.
Do you have any family history of liver disease or bile duct issues?
Not that I'm aware of.
All right, given your symptoms, it's possible you may have bile duct cancer or gallbladder cancer. These conditions can cause jaundice, abdominal pain, and changes in stool color due to bile duct obstruction. I'll need to order imaging tests like an ultrasound or a CT scan and possibly an MRI to assess your bile ducts and liver.
That sounds serious. What could have caused this?
There are various risk factors like chronic inflammation of the bile ducts, a history of gallstones, or primary sclerosing cholangitis, but sometimes these cancers can develop without a clear cause.
What happens if the imaging confirms this diagnosis?
The next step would be to conduct further tests to confirm the type and stage of the cancer, such as an endoscopic retrograde cholangiopancreatography to collect tissue samples. Treatment depends on the stage, but often involves surgery to remove the affected part, sometimes followed by chemotherapy or radiation therapy.
That sounds intense. What are my chances of recovery?
Early detection significantly improves the prognosis. If caught early and if surgery is successful, patients can achieve good outcomes. However, it depends on the type and stage of the cancer, and each case is different.
What should I expect from the imaging tests?
These tests are typically non-invasive and will provide detailed images of your abdominal organs. Depending on the results, we may then proceed to more specific tests. All these tests will help us understand the extent of the condition.
I'm nervous about the possible outcomes.
It's normal to feel that way, but remember, we're here to guide you through the process and provide the best possible care. If the diagnosis is confirmed, we'll work together to develop a treatment plan tailored to your specific condition.
What should I do in the meantime?
It's crucial to take care of yourself. Eat a balanced diet if you can, get enough rest, and avoid alcohol. I would also recommend avoiding high-fat foods, which can aggravate symptoms.
I'll try my best to follow your advice. Thank you for your help.
You're welcome. Let's get the tests ordered, and I'll contact you once we have the results. Remember, we're here to support you through this.
I appreciate that. I'll be waiting for your call.
Take care, and I'll talk to you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, I see you've come in today for your scheduled follow-up. How have you been feeling since your last visit?
Not great, to be honest. I've been feeling increasingly short of breath, and even doing simple tasks like walking to the kitchen leaves me winded. It's been progressively worsening over the last few months.
I'm sorry to hear that. Besides the shortness of breath, are you experiencing any other symptoms?
Yes, I've been having this persistent cough, and it often brings up mucus. My chest feels tight, especially in the mornings, and I feel fatigued most of the time. Also, I've noticed my fingers are swelling, which makes wearing my rings uncomfortable.
That sounds quite concerning. With the symptoms you've described, one condition that comes to mind is chronic obstructive pulmonary disease. It's a group of lung diseases that cause breathing difficulties, often due to long-term exposure to irritating gases or particulate matter, commonly from smoking.
I smoked for almost 30 years before quitting 5 years ago. Do you think that has something to do with it?
Yes, smoking is the leading cause of chronic obstructive pulmonary disease. Even after quitting, the damage to the lungs from long-term exposure to tobacco smoke can persist and progress. Have you noticed any changes in your weight?
I have lost some weight recently, even though I haven't changed my diet. I attributed it to stress.
Weight loss can sometimes occur with chronic obstructive pulmonary disease due to the increased energy your body uses to breathe and the effort it takes. Have you experienced any leg swelling or pain?
Yes, my legs have been swelling more than usual, especially after standing for a while, and I sometimes feel a dull pain in my calves.
These could be signs of pulmonary hypertension, which is an increase in blood pressure in the arteries of your lungs. It can be a complication of chronic obstructive pulmonary disease. The swelling in your fingers and legs can occur when the heart has difficulty pumping blood effectively due to the increased pressure in the lungs.
That sounds quite serious. What tests would you need to confirm this?
We'll need to conduct some tests. First, we'll start with spirometry to assess your lung function. This test measures how much air you can inhale and exhale and how quickly you can exhale. A chest X-ray or CT scan can give us a detailed view of your lungs, while an echocardiogram can help evaluate your heart's function. We may also need a blood gas test to measure oxygen and carbon dioxide levels in your blood.
What treatment options are available if I am diagnosed with chronic obstructive pulmonary disease and pulmonary hypertension?
Treatment will focus on managing symptoms and slowing disease progression. For chronic obstructive pulmonary disease, lifestyle changes like quitting smoking and avoiding lung irritants are crucial. Inhaled bronchodilators and corticosteroids can help open your airways and reduce inflammation. Pulmonary rehabilitation, which involves exercise and education, can improve your quality of life.
What about the pulmonary hypertension?
For pulmonary hypertension, we may use medications like phosphodiesterase inhibitors to relax the blood vessels in your lungs, diuretics to reduce fluid buildup, and anticoagulants to prevent blood clots. Oxygen therapy can also help if your oxygen levels are low. In severe cases, surgery or a lung transplant might be necessary.
That's a lot to process. I didn't realize how serious my symptoms could be.
It's understandable to feel overwhelmed, but with proper management and treatment, many people with chronic obstructive pulmonary disease and pulmonary hypertension can lead fulfilling lives. We'll work together to develop a treatment plan that addresses your specific needs.
Thank you, doctor. I appreciate your support.
You're welcome. I'm here to help you navigate through this. Let's get the tests done and take it one step at a time.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've been reading the recent research on the new immunotherapy treatments for cancer. Have you had a chance to look into it?
Yes, I have. They are showing promising results, especially in cases where traditional chemotherapy has failed.
Absolutely. The specificity in targeting cancer cells while sparing healthy ones is a game changer.
Though the side effects can still be intense for some patients, the overall benefits seem to outweigh the risks.
Agreed. We just have to carefully select which patients are ideal candidates for these treatments.
Definitely, personalized medicine is becoming more crucial to get the best outcomes for each individual.
Now look at question 26.
The new telehealth protocols have made a significant difference in how we deliver care. What are your thoughts?
They really have. It's convenient for patients who find it challenging to come to the hospital, but it's still a learning curve for some of our staff.
True. Some patients miss the personal connection that comes with in-person visits, but the convenience of telehealth can't be denied.
We just need to ensure that the quality of care isn't compromised and that we accurately assess patients' needs remotely.
Agreed. With proper training and guidelines, I think telehealth will become an integral part of our practice.
Now look at question 27.
Hey Rachel, I've noticed Mr. Johnson's wound dressings need to be changed more frequently than initially planned. Do you think there could be an issue with the wound healing?
Hi Mike, I noticed that too. I've scheduled a wound care nurse to assess him later today. There might be an underlying infection slowing down the healing process.
Good idea. Let's get him started on a new antibiotic if the nurse recommends it.
Agreed. I'll also check his nutrition plan and ensure he's getting enough protein to aid his recovery.
Thanks, Rachel. Let's keep monitoring Mr. Johnson closely.
Now look at question 28.
Ryan, I wanted to discuss Mrs. Clark's fall risk. She's been quite unsteady on her feet lately.
Yeah, Julie, I noticed that during my rounds too. I think we should look into getting her a walker to help with mobility.
I agree, and maybe have her do some physiotherapy exercises to strengthen her legs.
Good idea. I'll put in a request for the walker and coordinate with the physiotherapy team for an assessment.
Great. Let's also remind the care team to be extra vigilant with Mrs. Clark's mobility.
Absolutely, we'll ensure she stays safe.
Now look at question 29.
The new robotic surgery system provides enhanced precision, allowing us to perform minimally invasive procedures with better control.
That sounds impressive. How does it improve upon traditional laparoscopic surgery?
It offers greater dexterity due to the 3D vision and enhanced instrument articulation, allowing surgeons to perform complex procedures with more precision and less fatigue.
I see. Are there any limitations or challenges associated with it?
Well, there's a learning curve, and the equipment is quite expensive, but the benefits of less post-operative pain, shorter hospital stays, and quicker recovery times make it worth the investment.
It will be interesting to see how it evolves and improves patient outcomes.
Now look at question 30.
Gestational diabetes is a type of diabetes that can develop during pregnancy due to hormonal changes affecting insulin.
So it's specifically related to pregnancy and usually resolves after childbirth, right?
Exactly. However, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life.
And how is gestational diabetes typically managed?
It's managed through a combination of diet, exercise, and sometimes medication. Regular monitoring of blood sugar levels is crucial to ensure the health of both the mother and the baby.
It's important to catch it early to minimize complications. Regular prenatal care and screening make a significant difference.
Definitely. Early detection and management are key in ensuring a safe pregnancy and delivery.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Chronic myeloid leukemia, CML, is a type of cancer that begins in the bone marrow, where blood cells are formed. It primarily affects adults and progresses slowly in its chronic phase. CML is associated with a genetic abnormality known as the Philadelphia chromosome, which results from a translocation between chromosomes 9 and 22. This translocation creates a new fusion gene, BCR-ABL1, which promotes the proliferation of leukemic cells. CML typically progresses through 3 phases: chronic, accelerated, and blast crisis. The chronic phase is often asymptomatic and can last several years. However, as the disease progresses to the accelerated phase, symptoms such as fatigue, weight loss, night sweats, and an enlarged spleen may become more apparent. The blast crisis phase resembles acute leukemia and is characterized by an increased number of immature blood cells, blasts, in the bone marrow and blood, leading to severe symptoms and a poor prognosis. Consider the case of Mr. Johnson, a 50-year-old man who was diagnosed with CML during a routine health checkup. He was initially asymptomatic, but laboratory tests revealed elevated white blood cell counts, which led to further investigation and the discovery of the Philadelphia chromosome in his blood cells. Mr. Johnson was promptly started on tyrosine kinase inhibitors, TKIs, the standard treatment for CML, which target the BCR-ABL1 protein. Over the next few months, he experienced significant reductions in his leukocyte count and was able to maintain his normal lifestyle. However, a year later, Mr. Johnson began experiencing fatigue and weight loss, and further tests revealed that his CML had progressed to the accelerated phase. His oncologist adjusted his treatment by switching to a second-generation TKI and monitored his condition closely. Fortunately, Mr. Johnson's condition stabilized, and he was able to continue with his adjusted treatment regimen. TKIs, such as imatinib, dasatinib, and nilotinib, have revolutionized CML treatment by specifically inhibiting the activity of the BCR-ABL1 protein. Their targeted mechanism allows for improved outcomes with fewer side effects compared to traditional chemotherapy. Patients like Mr. Johnson often require lifelong TKI therapy, although ongoing research is exploring the potential for treatment-free remission in certain cases. Regular monitoring through blood tests and bone marrow biopsies is essential to assess treatment response and detect any signs of disease progression. Despite the remarkable progress in CML treatment, several challenges remain. Not all patients respond to TKIs, and resistance can develop over time. Additionally, long-term TKI use can lead to adverse effects such as cardiovascular issues, which necessitate careful patient management. Ongoing research aims to uncover new therapeutic targets and develop drugs that can overcome TKI resistance. Clinical trials are also investigating combination therapies and novel agents to enhance treatment efficacy and reduce side effects. CML presents complex challenges for both patients and healthcare providers. The advent of TKIs has transformed the prognosis for many individuals, offering hope and improved quality of life. However, continued research and personalized treatment strategies are crucial to address the evolving landscape of CML management. In Mr. Johnson's case, early diagnosis and prompt intervention allowed him to achieve significant disease control, underscoring the importance of regular health checkups and ongoing monitoring. With the support of his healthcare team and the latest advancements in treatment, he continues to navigate his CML journey with resilience and optimism.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Acute respiratory distress syndrome, ARDS, represents a critical condition characterized by acute lung inflammation and injury, leading to respiratory failure. It's not a standalone disease, but a condition that can arise due to various insults to the lungs, such as pneumonia, sepsis, or trauma. ARDS affects thousands globally and has a high mortality rate, ranging from 35% to 45%. Early recognition and prompt intervention are vital for improving patient outcomes. ARDS occurs when fluid accumulates in the alveoli, the tiny air sacs in the lungs where oxygen and carbon dioxide exchange occurs. This accumulation is due to increased vascular permeability, often triggered by an inflammatory response. As a result, the lungs become stiff, impairing oxygen transfer into the bloodstream, which leads to hypoxemia. Ms. J, a 45-year-old woman with no significant medical history, developed flu-like symptoms that worsened over a week. She presented to the emergency department with severe shortness of breath. On examination, she had low oxygen levels and her chest x-ray showed bilateral lung opacities. She was diagnosed with severe ARDS, and tests confirmed H1N1 influenza as the underlying cause. Immediate admission to the ICU was necessary. Ms. J was placed on mechanical ventilation to maintain oxygen levels, and treatments included antiviral medications and corticosteroids to manage inflammation. Her critical condition required prone positioning and high positive end expiratory pressure, PEEP, ventilation. Over 2 weeks, her oxygenation improved, and she was gradually weaned off the ventilator. After intensive rehabilitation, Ms. J regained her functional status, although she continued to have reduced exercise tolerance due to residual lung damage. Like sepsis, ARDS can present subtly, especially in its early stages. Early recognition relies on high clinical suspicion in patients at risk. Managing mechanical ventilation is challenging. Setting the appropriate tidal volume and PEEP is essential to avoid further lung injury while ensuring adequate oxygenation. Fluid therapy requires a delicate balance. Too much fluid exacerbates lung edema, while restrictive fluid management risks renal complications. The use of corticosteroids, prone positioning, and extracorporeal membrane oxygenation (ECMO) are adjunctive therapies with specific indications. Their timing and appropriateness depend on the severity and underlying cause of ARDS. Research into biomarkers seeks to identify subtypes of ARDS to tailor treatments more precisely. Exploring non-invasive ventilation and high-flow nasal oxygen therapy aims to reduce the need for mechanical ventilation. Trials are underway for medications that target specific pathways involved in inflammation and lung repair. ARDS represents a formidable challenge in critical care medicine due to its varied etiology and high mortality. The case of Ms. J underscores the importance of early recognition and intervention. Despite advancements, further research is necessary to fully unravel its complexities and enhance therapeutic outcomes. Multidisciplinary approaches and continuous education are crucial to improving patient care and advancing the understanding of this complex syndrome.